Hey everyone, welcome back to NCLEX Practice Hub. If you're preparing for the NCLEX, you know that select all that apply questions can be some of the most challenging. But don't worry, today I'm sharing my top strategies to help you master these tricky questions. Strategy number 1, read the question carefully. Make sure you understand exactly what the question is asking before looking at the answer choices. Look for keywords that can guide your thinking. Let's take a look at an example question to demonstrate this strategy. A nurse is caring for a patient with hypokalemia. Which of the following interventions should the nurse implement? Select all that apply. In this question, the key phrase is, interventions should the nurse implement, which means we are looking for actions the nurse should take to manage hypokalemia. Of course, you need to know what hypokalemia is. Strategy number 2, evaluate each option independently. Treat each statement as a true or false question. This helps you focus on each option without being influenced by the others. Let's take a look at our sample question again with its options. A nurse is caring for a patient with hypokalemia. Which of the following interventions should the nurse implement? Select all that apply. A. Administer potassium supplements. B. Restrict fluid intake. C. Encourage high-potassium foods. D. Monitor ECG. E. Administer sodium bicarbonate. Now, let's evaluate each option independently to see if it is a correct intervention for managing hypokalemia. Administer potassium supplements. This is correct because potassium supplements are a primary treatment for hypokalemia to replenish low potassium levels. Restrict fluid intake. This is incorrect because fluid restriction is not typically part of the treatment for hypokalemia. In fact, ensuring adequate hydration is important. Encourage high-potassium foods. This is correct because dietary intake of potassium-rich foods, like bananas and spinach, helps increase potassium levels. Monitor ECG. This is correct because hypokalemia can affect cardiac function, and monitoring the ECG helps detect any related abnormalities. Administer sodium bicarbonate. This is incorrect because sodium bicarbonate is not a standard treatment for hypokalemia. It is typically used in cases of metabolic acidosis. By evaluating each option independently, you can clearly see which interventions are appropriate for managing hypokalemia. Strategy number 3, look for patterns. NCLEX often includes a mix of correct and incorrect answers. Be cautious if all answers seem correct or incorrect. This might indicate a misinterpretation of the question. Remember, it's rare for all options to be correct, so double-check each one. Strategy number 4, consider safety and priority. The NCLEX prioritizes patient safety, so choose options that prevent harm and prioritize actions based on the ABCs, airway, breathing, circulation, and Maslow's hierarchy of needs. Think about what will ensure the patient's immediate safety and well-being. Strategy number 5, practice, practice, practice. The more select all that apply questions you do, the more familiar you'll become with the format and the better you'll get at identifying the correct answers. Let's recap, read carefully, evaluate each option independently, look for patterns, prioritize safety, and practice. With these strategies, you'll be well on your way to mastering select all that apply questions on the NCLEX. Thanks for watching. If you found this video helpful, please give it a thumbs up and subscribe for more NCLEX tips and practice questions. Good luck with your studies, and I'll see you in the next video. And if you have strategies that work best for you, please share in the comments.